Hi, Dr. Gullberg here, continuing our internal medicine series. Today we're talking about acute MI. This will be just a two-part series. Looking at MIs on electrocardiograms, location of myocardial infarctions. It's important to have an understanding of the leads. Obviously, in leads 2, 3, and AVF, this is the inferior wall of the heart. These types of infarcts are especially seen in smokers and associated with, again, the right coronary, associated obviously with blocks as well, first, second, third degree AV blocks. The anterior septal area of the heart is V1 and V2. The anterior lateral part of the heart is ST segment changes in leads 1, AVL, V3 to V6 is usually going to be more associated with LAD, circumflex disease. We call that, widowmaker's disease, especially when the LAD is involved. Subendocardial changes are usually ST segment depression or downsloping, where of course transmural infarctions or total thickness infarctions are usually with ST segment elevation, more commonly associated with complications of pericarditis, that type of thing as well. So immediate treatments, of course, include in the emergency room include aspirin, oxygen, nitroglycerin, orally or IV. Most cases, of course, are treated with a trip to the cath lab where percutaneous coronary intervention or PCI occurs. There, bare metal stents or drug-eluting stents are used. Meds for treating the thrombolysis is very important. These include Plavix, Effiant, or Brilinta, with the use of heparin or Lovenox. In the cath lab and after the cath lab procedure, glycoprotein 2B and 3A inhibitors are used, which block platelet and thrombin interaction. These meds include Riapro or Integralin, and now Angiomax, which is a direct thrombin inhibitor, similar to Horudin, the chemical in leech saliva. So there's basically 5 types of MIs. Type 1 is a spontaneous MI secondary to plaque rupture. Type 2 is an MI secondary to increased oxygen demand. Type 3 is an acute MI associated with sudden death. Type 4 is an MI associated with percutaneous angioplasty or stent placement. And type 5 is an MI associated with coronary bypass grafting. So there's just a summary of some facts about MIs. In the second series, we'll talk about the TIMI scoring as well as cardiac biomarkers. Thanks, Dr. Gullberg, signing off.